So there are a lot of effects of secondary trauma. So in the short term, you might find this with your children, irritability. That's a big sign of anxiety, sometimes depression. And it's the little things that will just irritate these kids. Emotional numbness, they might feel nothing, and numbness is a sign that something is wrong. Stress, we talked about, and difficulty concentrating. So some long-term effects of secondary trauma in children could be chronic anxiety, and that is because their world changed so completely. And that's what happens when your sibling has been a victim of a crime. Depression, burnout, and other health problems. So these are some mental and emotional symptoms of secondary trauma. A big one is intrusive thoughts or memories of the trauma. Nightmares are a very common symptom of trauma. They might experience increased levels of fear or maybe sometimes even panic. I don't want to go to that place, Mom. It scares me. I'm panicked because something about that might remind them of what happened to their sibling. We talked about irritability. Another one is angry outbursts. Kids don't have the emotional language to discuss what's happened to them or happened to their siblings. So a lot of times it comes out as like temper tantrums or maybe yelling, hitting a parent, something like that. Others could be feelings of helplessness or hopelessness. They might feel overwhelmed and become overwhelmed by daily things that they did that they wouldn't have been overwhelmed by before. Memory issues is a really common thing with PTSD. A lot of times our brain will protect us from the trauma we experienced. Social withdrawal. This is a big one for kids who have experienced a trauma. They might not want to go over to their best friends anymore. They might not want to go to their after-school program. They're staying inside. They're not going outside playing with their friends. If your child previously enjoyed activities of a social nature and all of a sudden they are withdrawing into themselves, that might be a good thing to watch out for. Changes in their sleep pattern, changes in the appetite. They might avoid situations or experience that might remind them of the trauma. They might have increased vigilance. That's a huge sign of trauma. They might be very good about reading the temperature of a room, just kind of know what everybody's emotions are so they can protect themselves. There's also some physical symptoms of trauma that we don't often talk about, and that is trauma can actually hurt. It can cause muscle pain. It can make you incredibly fatigued. Your brain's doing a lot of work trying to process that trauma, so it can be very tiring. And other things are headaches and stomach pains. So kind of going back, what does the science say? Many studies have shown that there's a strong evidence of siblings of children who have a disability, and a lot of our shaken baby survivors do have some profound disabilities. They are at higher odds of developing depression or other mental health difficulties compared to children of siblings who don't have disabilities. So what the research says is they are suggesting that these children are a vulnerable group, and that this vulnerable group is in needs of programs and services to help support their mental health.